When we started, there were a number of challenges. We weren't sure how our patients would receive it. Most of our patients are older patients who may not be technologically facile. They may be hard of hearing, issues like that. But we have a nurse on the other end, and the patients take to it immediately. Our patients rate the experience at 5.9 out of 6. They love it. They love it because it saves them travel. And the distances are extensive to travel in this province. We always have winter, we always have mountains and hills. Roads are icy and slippery, and distances are far. There's a travel risk. It's a low travel risk, but our patients are older. They have to travel long distances. They have to travel through our BC mountains, and in the winter months, the driving can be hazardous. So we reduce travel risk. A lot of times in our healthcare budgeting system, in all the budgets, you won't find any measure about what the patients pay for their care. But if a patient has to come and spend 2 weeks unnecessarily in a hotel here and pay for their way to come here, it costs them a lot of money. And that's one of the reasons why the patients like it so much. We save the patients money. And I remember seeing a young woman in her late 30s who needed radical surgery following radiation and chemotherapy, and it was a very tense discussion. And she was in Nelson and I was in Kelowna. And, you know, after 2 or 3 minutes, the screen becomes invisible. You're just right with the patient. And the other thing that's helpful is that on the other side, we've got a nurse sitting with the patient. Now, when I'm sitting in the office, I've got the patient and the patient's relatives, but I don't have the nurse to support the whole psychosocial piece. But on the telemedicine, I've got the family on the other side, I've got the patient on the other side, but I've got a nurse on the other side, and the patients love having the nurses there. So we're able to navigate that in a way that amazes me. The provincial program kept me at it because it's been so enjoyable to work in a collaborative model where we're on contract and we're not competing fee for service. And as a personal aside, I think it's the salvation of Canadian medicine. I mean, we've got to go to some form of contract where we work together collaboratively.